Hello, I'm Chris Bailey. I'm going to answer some questions about knee conditions. So it can be difficult to work out where in the knee the pain is coming from. The commonest site for pain in the knee is in the cartilages of the knee, either the meniscus or shock absorber cartilage or in the lining cartilage. And this normally presents with a pain deep down within the knee, usually localised either to the inner or the outer side of the knee. Pain around the tendons or in the muscles usually occurs in the front or the back of the knee, and this may be the best way of isolating where the pain is coming from. So I've been asked about knee pain when climbing stairs. So this is quite a common phenomenon, and when we climb stairs, 6 times our body weight goes through our kneecap joints, and this obviously causes quite a large load going through the kneecap. If there's any issue with maltracking, if the kneecap is not running or moving centrally within the knee, that can often cause overload of one part of the kneecap, and 6 times your body weight going through a small part of the cartilage of the kneecap causes very high contact pressures and cause some wear in that area, and that's why we think people get more pain when going up and down stairs. So a lot of people experience knee pain and swelling, and often this is a fairly non-specific finding and may simply be due to overactivity and often settles down within a short period of time. However, sometimes people experience knee pain and swelling due to a traumatic condition because of an injury or an inflammatory condition. Probably one of the commonest causes we see is wear and tear or degenerative conditions such as arthritis or wearing out of the cartilages of the knee. If it's persisting for a number of weeks and getting more painful, it's always worth getting it looked at. So some people describe numbness around the knee in association with their pain. It can be difficult to describe the reason for this anatomically, but we think that swelling of the knee can sometimes cause some pressure on local nerves, giving a fairly diffuse feeling of numbness around the knee. A lot of people describe numbness after surgery, particularly knee replacement surgery, as unavoidably we do divide some of the small nerves at the front of the knee when we do knee replacements. If the numbness is more distal, lower down within the knee or the foot, this can sometimes be due to pressure on one particular nerve around the knee, and I would suggest this requires further investigation. So sometimes it can be difficult to say whether pain is coming from the knee or the hip joint, particularly if the pain is fairly diffuse throughout the leg. Obviously X-rays can help, but before that it can be worth having a look at your hip and your knee and looking at the movements there. If your hip is very stiff, it may be that a lot of the pain is coming from this area. X-rays can help, but sometimes we use injections, and if we inject local anaesthetic into either your hip joint or your knee joint, this will numb the joint, and if the pain goes away, it's likely that that's where the pain is coming from.